A report came out within the last 24 hours. Dr. Bill Trattler in the US published on another ophthalmic journal and mentioned on LinkedIn. He said the following: "Hi everyone, I wanted to share an article I wrote with Gary Wartz, etc., that puts together some of the basic science and clinical studies around hydroxychloroquine for both prophylaxis and treatment of COVID-19. Multiple studies suggest that this medication can speed recovery and help eliminate the virus in hospitalized patients. Do you know of this drug, and do you have experience, and do you believe that it could help?"
In India, we've been using this drug a lot because of malaria, because it's one of the countries where incidence of malaria is high. So in my childhood, I remember taking a lot of chloroquine, and there was a time when we had almost like a weekly dosage of preventive chloroquine that had to be taken. Chloroquine is also being used for a lot of these autoimmune kind of problems as well. So the ICMR study, which has come out, and there they've said is that the health workers who have been closely exposed to the virus or have been interacting closely with the COVID patients, it is a good prophylactic medication for them. So
Yeah.
I'm not too sure whether everybody should off the counter start taking chloroquine, but I don't think that is a good idea because it does have a lot of toxicity. It has hepatotoxic as well as the optic nerve can also be affected, as we all know that. Yeah.
The optic nerve, you said?
Yeah. Been taken for a longer time because problems in the optic nerve as well.
I was speaking to Ken Fong in Malaysia, who's been the previous Malaysian Society of Ophthalmology president, and he said something similar in the sense that ophthalmologists often know of this drug because patients present with problems related to the retina. And so, similarly, he did not advise use of that drug for patients potentially the most severe, but only if they're perhaps end stage. Otherwise, the risk of complication could be too great. Would you agree?
Yes, absolutely. I agree for that. Yes.